When the TB bacteria becomes active and the immune system can't stop the bacteria from growing, this is known as tuberculosis. Hello and welcome to tonight's World Health episode. My name is Auer, and tonight I will be taking you on the ride through the pandemic of tuberculosis, a disease that was once the leading cause of death in the United States, a disease that has been making its impact for more than 3,000 years and is still prevalent today. Tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. The bacteria attacks the lungs. However, TB bacteria can attack any part of the body. There are two different types of tuberculosis: latent tuberculosis infection, LTBI, and TB disease. With latent TB, the TB bacteria can live in the body without making a person sick. In latent TB, the body is able to fight the bacteria, which in turn stops it from growing. However, when the body is not able to stop the bacteria from becoming active and multiply, this is known as the TB disease. People who have TB disease are sick and can spread the bacteria to other people. Let us dive into the history of tuberculosis. Jonas Scullin coined the term tuberculosis back in 1834. However, TB has been around long before that. TB can be traced back thousands of years ago off the coast of Israel. In the 1600s to the 1800s in Europe, TB was the cause of 25% of all deaths. In the year 1882, Dr. Robert Koch announced the discovery of Mycobacterium tuberculosis, the bacteria that causes TB. During this time frame, TB killed 1 out of every 7 people living in the United States and Europe. In the year 1893, the first published report on TB was produced. In 1904, the National Association for the Study and Prevention of TB was developed. In 1907, Clemens von Burkitt developed a skin test that put a small amount of tuberculin under the skin and measured the body's reaction. In 1908, that was updated by Charles Mintox, and he used a needle and a syringe to inject the tuberculin. In 1921, Albert Clementi and Jean-Marie Camille Guin developed BCG vaccine. This vaccine is given to children and infants to prevent TB. In 1953, the first ever nationwide published report for TB reported an astonishing 84,304 cases of TB in the United States alone. From the years 1985 to 1992, rates of TB in the United States increased. This was due to the HIV epidemic, cutbacks in the public health infrastructure and treatment programs, increasing poverty, homelessness, and drug abuse. In 1993, the World Health Organization, known as WHO, declared TB a global health emergency. In 1995, the World Health Organization WHO launched DOTS, Directly Observed Treatment Short Course program, as a control strategy for tuberculosis. The resurgence of TB led the Institution of Medicine to write a publication in 2000, and this publication led to TB control in the United States. In 2016, the United States Preventative Service Task Force released guidelines on targeting testing and treatment of latent TB infection to prevent future cases of TB. In 2017, there were 9,105 TB cases in the United States. From the information provided about the history of TB, we have clearly come a long way. However, we still have a long way to go. Here you see the first graph of many that I will be showing you in tonight's episode. This graph is from a study done on the global epidemiology of tuberculosis. This graph shows the trends in estimated TB mortality rates from 1990 to 2012. Global mortality rates have decreased by 45% since 1990, which says a lot about how far we've come with tuberculosis. Mortality rates due to tuberculosis are declining in all 6 WHO regions, which you see above. By 2012, the prevalence rate had decreased globally 37% since 1990. Regions of America are doing much better than others, having the 1990 level of TB prevalence by around 2004. If you look at the graph, you see that it goes until 2015. This was a prediction of TB mortality rates from 2013 to 2015 by the WHO when this particular study was conducted. Estimated TB mortality excluded TB deaths among HIV positive people during this prediction. Shaded areas above represent uncertainty bands. The horizontally dashed lines represent the Stop TB Partnership target of a 50% reduction in the mortality rate by 2015 compared with 1990, and the other dashed lines show projections up to 2015. About 1/4 of the world's population has latent TB, which means people have been infected by TB bacteria but are not ill with the disease and cannot transmit the disease yet. People infected with TB bacteria have a 5 to 15% lifetime risk of falling ill with TB. When a person develops active TB disease, the symptoms such as cough, fever, night sweats, or weight loss may be mild for many months. Because these symptoms can be mild for months, this can lead to delays in people seeking medical treatment, and this results in transmission of the bacteria to others. People with active TB can infect 10 to 15 people through close contact over the course of a year. People who are infected with HIV are 20 to 30 times more likely to develop active TB. TB is also greater in people who suffer from other conditions that impair the immune system. The use of tobacco also increases the risk of developing TB disease and leading to death. The next chart is from World Health Organization, known as WHO, and it takes a look at patients living with TB and HIV from 2004 until 2011. This chart shows a steady increase in the percentage of people living with HIV and TB from 2004 to 2011. It is clear from this chart that most of those cases occur in the African region. People living with HIV are much more likely than others to get ill with TB if they breathe in the bacteria. This is due to their weakened immune system. Their weakened immune system makes it harder for the body to fight off the infection. Having HIV also makes TB more difficult to diagnose and treat. Leaving a TB infection untreated speeds up the damage to a person's health from HIV. An estimated 920,000 people living with HIV worldwide fell ill with TB in 2017. TB is the leading cause of death among people with HIV, accounting for some 300,000 people who died from HIV-associated TB in 2017. Globally, PL-HIV were 20 times more likely to fall ill with TB than those without HIV in 2017. Taking it back just a year prior to 2017, in 2016, there was an estimated 207,000 TB deaths among HIV-positive men, 115,000 among HIV-positive women, and 52,000 among HIV-positive children. The WHO African region accounted for 86% of those deaths. Tuberculosis is the 9th leading cause of death worldwide and the leading cause from a single infectious agent, ranking above HIV and AIDS. In 2016, 2.5 million people fell ill with TB in the African region. The astonishing 2.5 million people in the African region who fell ill with TB accounted for 1/4 of new TB cases worldwide. In 2016 alone in Africa, about 417,000 died from TB. About 82% of TB deaths among HIV negative people occurred in the WHO African region. Although the African region has high numbers of TB deaths and TB with HIV deaths, the United States has made great strides in the fight against TB. As you can see from this table by the CDC, TB has come a far way since the year 1957 in the United States. In 1957, there were 67,149 incidents of TB in the United States. In 2017, there was 9,105 incidents of TB in the United States. That is a reduction of over 58,044 incidents of TB in the United States in 60 years. The discovery of antibiotics for the treatment of TB played a huge factor in this reduction rate. There is a vaccine for TB, which was mentioned earlier in this episode, called BCG. However, BCG is not a commonly used vaccine in the United States. It is mostly used in other countries where TB is common and is given to infants and small children. This map by the WHO shows estimated TB incident rates in 2017. Places like Western Europe, Canada, the United States, Australia, and New Zealand incident rates are less than 10 cases per 100,000. Americas have the lowest burden of TB on average. Countries that are in the top 10 worldwide of incident rates include places mostly in Africa. In South Africa and Swaziland, 1 in every 100 people develop TB each year. If you look at the map above, the dark green shows the highest incident rates of TB. TB is a treatable and curable disease. TB disease is treated with a standard 6-month course of 4 antimicrobial drugs that are provided with information, supervision, and support to the patient by a healthcare worker or a trained volunteer. Without such support, treatment and adherence can be very difficult, and the disease can be spread. The vast majority of TB cases can be cured when medicines are provided and taken properly. Between 2000 and 2015, an estimated 49 million lives were saved through TB diagnosis and treatment. The WHO pursues 6 core functions in addressing TB. 1. Providing global leadership on matters critical to TB. 2. Developing evidence-based policies, strategies, and standards for TB prevention, care and control, and monitoring their implementation. 3. Providing technical support to member states, catalyzing change and building sustainable capacity. 4. Monitoring the global TB situation and measuring progress in TB care, control, and financing. 5. Shaping the TB research agenda and stimulating the production, translation, and distribution of valuable knowledge. 6. Facilitating and engaging in partnerships for TB action. The WHO End TB strategy, adopted by the World Health Assembly in May 2014, is a blueprint for countries to end the TB epidemic by driving down TB deaths, incidents, and eliminating catastrophic costs. It outlines global impact targets to reduce TB deaths by 90%, to cut new cases by 80% between 2015 and 2030, and to ensure that no family is burdened with catastrophic costs due to TB. Ending the TB epidemic by 2030 is among the health targets of the newly adopted Sustainable Development Goals. WHO has gone one step further and set a 2035 target of 95% reduction in deaths and 90% decline in TB incidents, similar to current levels in low TB incident countries today. The strategy outlines 3 strategic pillars that need to be put in place to effectively end the epidemic. Number 1, integrated patient-centered care and prevention. Number 2, bold policies and supportive systems. Number 3, intensified research and innovation. Although TB has come a far way from when it first became an epidemic, we still have a far way to go. TB is still one of the top 10 causes of death worldwide. Just last year in 2017, 10 million people fell ill with TB, and 1.6 million died from the disease. In 2017 also, an estimated 1 million children became ill with TB and 230,000 children died from TB. Multi-drug resistance TB remains a public health crisis and a health security threat. WHO estimates that there were 558,000 new cases with resistance to rifamycin, the most effective first-line drug, of which 82% had multi-drug resistant TB. Globally, TB incidents are falling at about 2% per year. This needs to accelerate to a 4 to 5% annual decline to reach the 2020 milestone of the End TB strategy. An estimated 54 million lives were saved through TB diagnosis and treatment between 2000 and 2017. Ending the TB epidemic by 2030 is among the health targets of the Sustainable Development Goals. I want to thank you so much for joining me for tonight's World Health episode on tuberculosis. I want to thank our sponsors, the CDC, WHO, and the American Lung Association, for providing us with data, statistics, graphs, and charts to help explain the epidemic of tuberculosis. A special thanks to Google for allowing us to use their images on tonight's broadcast. I look forward to seeing you all next week for the epidemic of malaria. Have a great night. As always, if you think you or someone you know is suffering from tuberculosis, please seek immediate medical attention.